Hello everyone, welcome back to my another YouTube video. So in this video I'm going to explain about how to give IV bolus. So IV bolus is a kind of a medication. It's like a push medication that we give. So we give floss and then we give medication, and after that we give a saline floss again, right? So I'm going to show you step by step how to give this medication, and I'm going to explain what I understand about it as well. So there is a patient called Jane Danger. So she has pneumonia, right? So for that pneumonia we have to give antibiotics. So she was on ceftazone, which is a third generation antibiotics, for a long time, and then doctor said that because he was in this medication, are we able to give the new so we are giving ceftriaxone, but she has a history of rash from cefazone. So both of these medication are antibiotics for pneumonia, but it falls under the same medication category, that is sulforaphane, right? So that means that we are talking with the doctor about can we give the medication or not, and doctor said it's fine because it was a mild rash. So after we verify from the doctor and doctor's order, we already got the doctor's order, we're gonna proceed into what we can do about it, right? So we have to have an idea like what are the items that we need, what are the equipments we need to administer this medication. So before that we have a very crucial things. 11 writes 3 medication checks that we need. The first check is with yourself, second check with RN, third with RN with yourself, with the bedside patient. So I'm gonna show you what are the documents that we need basically for so this is a VIP chart, or not, yes, this is one. So VIP is basically visual infusion phlebitis, that checks the cannula is under, is it stable, is it patent or not, how is the cannula working, is it bad, how bad it is, right? So these are the stuff that we look after when we look at the VIP score. So if the VIP score is 0, it's fine because there is no sign of edema or swelling or pain, right? 1 is totally fine. 1 is like there might be a little bit of pain, there might be but we're gonna observe it carefully, but that's fine, we can proceed. But if it goes from, you can see the red thing, right? So if it goes from 2 to 5, then that means that that's a danger zone. We are not administering the medication, we have to recite the whole cannula, which is totally fair because we don't want to take the risk. There might be something wrong, there might be edema, there might be erythema, pain along the cannula, and there might be a lot of issues that comes along the way. But we're gonna check the VIP score before administering that as well. So I'm gonna for example, I'm gonna gather all the things that I need before I start the thing, right? So for example, this is what, for example, I'm gonna use this for a while, and this is gonna take a bit longer because we're gonna need like, we're gonna have to make 3 floss, we're gonna make the medication itself, so that's why it's gonna take a long time. So I'm gonna show you step by step what are the things that I need, right? So the documentation is we need VIP score, and the second thing we need is medication chart. These are the 2 documentation we need. Now, so this is, so basically the ceftazone, right? This is antibiotics. So there is some powder in it and we're gonna mix it with water. So how do we know how much we are giving, how do we know what is going on, is you have to look up to Australian Injectable Handbook, which is AIDS, that tells us how much concentration we are giving, how much of medication we are giving, and we have to look it up in the computer. I know this because I have done practice sometimes in my uni, so that's why I know what I'm doing. But normally there is some powder and we're gonna mix it with the water or saline 0.9 solution. So start with the, so we need 3 10 ml saline, right? So for example, I have this 3 saline, as you can see. So this is the saline. So you always need, I already did it, but you always need to label this with saline, right? So how do we do it? Have a look. So this is the 18 gauge drawing up needle, just to draw up from the plastic saline. You're gonna take it like this, aseptic non-touch technique, right? And then for example, I don't have any kind of vial, so I'm gonna draw some water. I'm gonna 10 ml from my cup of water, right? So there is some, this is the saline, for example. I'm gonna draw this up. Cool. So as you can see, it's 10 ml. Now I'm gonna put it back. Never recap like this, as I have said multiple times. Always recap like this, right? I have already done it, and never always make sure that the labeling that you are doing is is never gonna touch this line as well. It's always make sure that it's always on the sideline, so that you are not missing things out, and you are able to read the readings properly. So that's done. So I'll put it aside. This is done. This is ready for the flush. I'll put it here. Cool. Now I'll make a, this is the first flush that we're gonna do, is right. So I'm gonna do post flush as well. This is a pre flush. I'm gonna make the post flush as well. So this is gonna be the post flush. I don't know the saline, this is different. So as usual, I'm gonna take out the packet, I'm gonna check the expiry date, I'm gonna make sure that the thing that I'm doing is right. I already went to the room. So these are the things that we need, right? I'm just making things up, but there is a procedure to it, there is a process to it. So before doing anything, you're gonna gather all the you're gonna gather all the equipments that you need. And once you know what goes on, you're gonna go to the patient's room, right? And now you're gonna explain, hi, my name is Hansel, I'm gonna be your EM nurse for today. I'm here for your IB bolus, and it's antibiotics for your pneumonia, right? And are you okay? Do you want to go to the washroom and things like that? And then do you have any allergies or things like that? Everything, right? And do your 11 rights as well. So when you are by yourself, you're gonna do the 11 rights, like right patient, right, and check the VIP score. And how is the cannula assessing? Like, do everything as you can. And after that, you're gonna come to the patient medication room for your first check, and you're gonna take all the things that you need. You're gonna take out from the drawer, and then you're gonna start assembling it. You start making it, right? So you're gonna call the RN for second check, and she's gonna check how good you are doing. So I'm gonna draw the second needle as well. For example, I am with the RN at the moment, and the RN is looking at me how I'm drawing the needle, right? All one hand always in the back, and you're gonna take it like this. Cool. This is a saline as well. I don't have the label for now, but this is a saline as well. This is a post flush, right? Cool. Now we're gonna make the bolus, which contain the antibiotics, right? So for this one, there is always a labeling, and you have to write it down. So it looks like I think I do have the thingo, but as you can see here, right? So it says what you are giving. So it says the name of the patient is Zen Danger, the one that we do for subcut as well. So ceftriaxone we give 1 gram per 10 ml 10 mils, 1 gram per 10 mils. That means the amount of medication it has is 10 ml, and the amount of volume of liquid we are mixing it is 10 ml, right? 10 ml of water we are doing that. So 100,000 mg divided by 10 equal to 100 mg by ml, right? So we're going to calculate it and we're going to say diluent. What is a diluent? So diluent is a water for injection. What did we mix with the antibiotics to make the medication? So we use water, right? So that makes sense. And fill up the dates and ID and your signature as well. And you're going to put it here in this syringe. Once that's done, you're gonna so you're gonna change the expiry date, you're gonna check everything, and you're gonna use the 21 gauge green one, 21 gauge syringe, because the smaller the gauge, the longer the syringe, and we're gonna mix it up. So as you can see how long this is, right? But if I pull you up the 25 gauge syringe right now, it will be very small, right? So this is a longer one syringe, that makes it easier. So I'm gonna take it like this, non-touch technique. Cool. Now what I'm gonna do, but hang on, I did a mistake here. So what I did was I need to draw from drawing up needle the water, right? So I have a drawing up needle, so that means I need 3 draw up needles, right? I'm gonna take it like this, and I'm gonna draw so this is the water as well. So everything is from here because I don't have the required equipments that is needed, right? So I'm going to take it like this, draw 10 ml. This is actually not a 10 ml, I think this is a 5 ml, but let's assume this is a 10 ml as well. And we draw from drawing up needle as well. Drawing up needle is really not sharp, it's just like bold here. And then we're gonna take it out because we just use for like drawing up. We're gonna chuck this in the thing, and we're gonna use the another one, this one, right? Cool. This is the what is this? This is the antibiotics that we're gonna use. We're gonna mix it up, right? So take this out, and prick here. Now slowly goes in. As you can see, it's going on in, right? Slowly going. Now the only thing that you need to do is now cool. Now you're gonna mix it up. Mix it up and make sure that there isn't any kind of like how if it's not like mixed properly, there is some layer on the top of the thing and you always feel like what is this. So let's not do that. Let's mix it properly so that there isn't any kind of solution hanging down there just like unmixed, because the better the mixed, the better it is, because the antibiotics is required. Now once you did the mix, right, take it out. Now you're gonna draw it up, because you draw 10 ml, so you're gonna draw 10 ml as well. You know how to draw properly. Yeah, you can do like taking out and doing like that as well if you want. And it might be hard for some people, but I think over time you will get over it. Draw like this. It's kind of really hard because it's creating the vacuum there. Alright, cool. Now I draw 10 ml. Right? Now I'm gonna take it back. So as usual I said, don't use your hand to prick, otherwise you might prick yourself. Use this, like, do like this. Oops. Cool. Now this is ready. So what we got? We got the antibiotics, we got this 2 saline for post and pre, right? So we got 3 items, and you're gonna put this medication here as well. So we did everything in front of the nurse. Nurse is happy. She had a look. So just grab yourself alcohol swab as well to clean it. And before breaking this, you always make sure that clean the top of the vial using alcohol swab as well. So we have a patient here. Let's assume again that this is cannula, right? This is a cannula right here. We did your thing. Now we go to the room. Hi Zain, how are you doing? My name is Hansel. As I was here 10 minutes ago, and this is the RN, right? So in the bedside, we're gonna do 11 rights. Hi. So we're gonna check this. So we got the VIP check. We got the medication order right here, right? We're gonna check it. So right patient, right order. Okay, right order. Okay, how much we're giving? Okay, 10 ml we are giving. Okay, it's written here. Now we're gonna assess the VIP, assess the cannula. So the cannula looks fine. Cannula looks there isn't any, and we're gonna ask, like, do you feel any pain in your cannula? Like, have a look there. Like, is there any swelling? Is there any erythema or redness there? Right? If it is there, then we have to recite it. So there isn't. Right? Cool. That's good. We did the 11 rights. We did the VIP assessment check. We check like if there is any kind of thing including this area, and we're gonna fill it up as well. So we're gonna indication. So if there is an indication VIP score is 0, and the date, time, and birth of the patient as well. Cool, right? So now what we're gonna do is calculate those. Now, so we did a recheck, right? We are ready to go. Now we're gonna tell her. So we are going to give this antibiotics plus. Are you okay? Are you ready? Okay, she's ready. Now we're gonna take out the cannula. There is a thing on cannula, cap on cannula. Take out the cannula. Get your alcohol swab. Clean this using that alcohol swab. So this is the alcohol swab. Take it out like this, the way I'm taking it out. This is an actual alcohol swab, right? And then clean the hub. Clean the hub for 10 to 15 seconds. Clean the hub for 10 to 15 seconds. So because we are giving, right? So there is, if there is an infection, or if there is any kind of bacteria, so to avoid the contamination, because the alcohol swab kills them off, right? Now, so what we're gonna do is we're gonna give the swab. So we're gonna take this out, the needle, right, as you can see here, and go in here and push. Don't push very hard because it can give speed shock. Push, like push and stop, push and stop, push and stop. So that pushback method is used normally when you are giving saline, because if you give like push, like within like couple of seconds, then it might create split shock. So give it easily. The first one, give it easily. The longer you take time, the better it is, right? And now our time to antibiotics. You need to give antibiotics slowly as well. May take 1 minute, take 2 minutes, doesn't matter, right? Okay, I'm just pouring it in my cup as well, right? So antibiotics on 2 minutes, take push back, push back. After some time, give this post saline as well, right? Push back, 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 push back. Done. Chuck this in the yellow sharp container. Document everything. What did you give? How much you give? Did she feel any pain? Close the cap. Tell her how do you feel, right? And once that's done, you basically need to, right? So what do you need to do? Yeah, so you clean for 15 seconds. The first floor, okay. Push the line again, saline now clear, soft container, everything gone. Alright, Johnny, you're all set. You give the call bell as usual, like whatever the normal procedure is, like, you know. And always, I think I forgot to talk about hand hygiene. Do your hand hygiene properly, like do your hand hygiene, use gloves, you know, the basic precaution that you have to take. So I will report to RN if I notice any kind of unusual rash. So normally what happens is, like, if you are doing infusion or if you are doing any kind of you know, antibiotics, there might be an occurrence of rash or any kind of allergies that a patient might face. So to make sure that that doesn't happen, you have to observe them for some time, or maybe take vitals as well. So for that, if you find any rashes, then you need to report to your RN or who is your supervisor. It might be your doctor. So tell them quickly, ASAP. And then I will start assessing the vital signs, right? I will assess effective monitoring, the hourly vital signs. I will improvement in skin signs like fever, right? And yeah, that's all. Answering this, you know. And also, like, sometimes what happens is, like, some people forget to give medication, right? So what might it cause? Because they might be busy, maybe because they forget to do the 3 6 11 rights. And these are the things that's like we try to avoid in these medical settings. And for example, what if someone give wrong medication? Should you like worry about it? No. If you give the wrong medication, that's fine, you already give it, right? So you need to escalate it. You need to escalate it by telling your RN ASAP, like what can be done, taking early vital signs after you give the medication, and like be honest about it, like what did you give, you know. And do the open disclosure. Also do the, like, report the incident, like do the complete the incident report, like that will help the patient might recover, rather than being away, like running away from the fact that you give wrong medication and like talking about it. You need to like actually understand, you like, okay, I gave the wrong medication, now how I escalate, how I make it better. So you have to think in such a way where that even if you made a mistake once, you need to make sure that that mistake can be minimized a little bit less, because you are helping them clear them out, right? Cool. Now this is it. That's it. Beautiful. Now for bolus, the important thing is, as usual, the process is same. You need to know what are you doing, and you need to also you need to make sure that what you are giving, right? What are the documents you need? What are the things you need? Like you need to have a keep in mind. And yeah, it's just about communication as well. And thank you for watching. I will make you another video. I will see you in another video. And thank you very much.